In this video, you're going to learn 8 flaws that you might be making or your doctor's offices may be making that are going to lead you towards taking drugs when you may not actually need them. These are so important because when it comes to taking blood pressure medications, you really want to be careful. If you only want to take them if it's absolutely necessary, because there are side effects, and these side effects can be significant. That's for another time, but right now we're just going to dive into these big flaws. Now, at the end of the video, there'll be something on the right here in discussing other mistakes that can be made. I'm sure there's some that you can think of, so let me know in the comment section, but let's dive into number 1. And that is that when we check a person's blood pressure, as doctors, we're supposed to be checking their resting blood pressure. That's very important because most people forget the word resting and just simply check the blood pressure. It has to be under a controlled environment, because if it isn't, then we're just taking blood pressure at any moment's notice. I'm going to make a joke here. It's not really funny because this happens all the time, but imagine if we had a standardization for blood pressure and we required that you run up a flight of stairs 2 or 3 times, and then we discuss with you whether you're depressed or not. Then we say some things that make you angry, give you a cigarette, and then check your blood pressure. If that's the standardization, then everybody would read high. Well, of course, that's not really a representation of what your resting blood pressure is. The standardization, by the way, is doctors are supposed to be checking your resting blood pressure, and very often patients are not rested. They're rushed into the rooms. They may have to go to the bathroom. They may be under a stressful environment. They may have some concerns, emotional concerns, and then they start talking to the patient while they're checking the blood pressure, and then they put the blood pressure on too tight. There's a million reasons, but ultimately, just simply not being rested is a definite flaw in checking your blood pressure. Number 2, not understanding that blood pressure numbers will fluctuate. If we check your blood pressure every hour on the hour for a 24-hour day period, you're going to find that your blood pressure goes up at times, it goes down. Under stressful environments, it goes up. Under non-stressful environments, it goes down. If you're walking, your blood pressure is going to be higher than if you are lying down. So blood pressure numbers do fluctuate. They fluctuate from moment to moment. And a blood pressure cuff is totally based on technique. And if the technique is wrong, if you change technique as you check blood pressure, you're going to get different numbers every time you take it. So understanding that your blood pressure fluctuates will give you an idea that you should really be taking averages over a period of time. But again, back to number 1, it should always be checked when you are resting. And it's for this reason that you don't freak out over one blood pressure reading. If you check your blood pressure and it's a number, and then you wait 2 minutes and then check it again, it could be totally different. It's important that you understand that these numbers can fluctuate, and that is totally normal. The 3rd flaw is not understanding white coat syndrome. This is a big one because when patients come into the office, they're nervous, they're scared, they don't know what's about to happen. Usually patients are coming into a doctor's office and they have to take a day off work, or they're nervous. And these nervous reactions in our nervous system cause the blood pressure to go up, particularly the systolic number, the first number of your blood pressure. Well, it shocks me because this seems like Doctor 101. It's the first thing that you're taught in school, or it should be in nursing school and medical school and chiropractic school and osteopathic school, is that patients are nervous, and so when you initially take their blood pressure, it's going to be higher than it normally would. So you have to understand that white coat syndrome, back when doctors used to wear white coats, this is how far back it goes, that you have to allow a certain amount of stress to be understood so you don't freak out over the blood pressure numbers on the first reading, the first time you're meeting a patient. Very often doctors will check the blood pressure initially and then wait till the end of the visit, check it again, or get to know you a little bit, and maybe after 2 or 3 times that you're in the office, check it again when of course the patient is more comfortable with the doctor. The fourth flaw is getting tied into and getting in love with one number and thinking that that one number is your blood pressure. Again, through all of this, you've learned that blood pressure will fluctuate a bit. So when someone says, well, my blood pressure is 134/82, they almost hold on to that number if it was like their age. So if you're 65 years old, tomorrow you're 65, and the day previous you were 65. So you get to have that number for an entire year. Well, that isn't how blood pressure works. Our blood pressure, you want to get averages so that you can get a ballpark figure of what your blood pressure is. But people get tied into this at thinking, well, my blood pressure is this number and it should always be that number. So a person who has 132/84 will think, well, that's my number, right? And then they check their blood pressure and it's 128/32 and they're confused by it. It's just not the way it is. Also, if you're getting diagnosed high blood pressure as a high blood pressure patient and they only took one reading one time, that is a bad idea. It can lead to you taking blood pressure medications when you actually don't need it. The fifth flaw is not taking blood pressure in context with other findings. If the blood pressure reading can fluctuate drastically and can be affected by things like white coat syndrome, then you can't put all your marbles into that basket, so to speak, of one reading. So you got to look at blood pressure as just one finding on a patient. So if a patient's blood pressure is a little high, but their blood sugar is normal, their insulin levels are normal, their body weight is normal, their stress levels are normal, and you get to know the patient, and let's say they're young, you're not going to freak out about their blood pressure as much as if they were also a smoker, they had high blood sugar, their insulin levels were high, they're not taking their medication for their diabetes. I mentioned they smoke cigarettes, they have a high pressure job. In that case, you may want to actually give the patient some medication because you may save their life, who knows, because they're clearly not going to change their life habits. But under that context, the need for drugs can change. So just looking at the numbers, if a person comes into a doctor's office and they have high numbers and just giving them blood pressure medications based on that number without taking it into context with other factors that can cause problems, it's not right. In addition to that, and part of this goes into, you have to also look for the cause. I had a patient recently who was taking blood pressure medications and was just throwing the medications. Then finally one doctor she saw, a new doctor, tried to find the cause. It turned out she had an adrenal gland tumor. And so she ended up having surgery. Just so you know, an adrenal gland is a gland above the kidney that produces a hormone called aldosterone. And what aldosterone does is it forces your body to retain water and retain salt, which for some people can raise their blood pressure. And in this particular case, that was it. Once that problem was solved, they found the cause of the high blood pressure. The blood pressure went down to normal levels, and now she's off blood pressure medication. The sixth flaw is age and not taking age into consideration. There are some guidelines that they're kind of ridiculous, that a person who's 80 years old should have the same blood pressure numbers as a person who's 20, that this magical number 120/80 is something that everyone should achieve, regardless of their age. This is, of course, ridiculous. I can prove this to you. You take an older person who's got normal blood pressure, but gets, let's say, white coat syndrome, or goes to the doctor and is nervous. You put them on blood pressure medication. Many people, they have side effects where they feel dizzy, they feel faint, they have no energy, their legs feel weak. These are all side effects of drugs that treat blood pressure. And when you give this to a healthy older person, you're basically giving them side effects and no benefit. So at a certain age, I mean, if you've made it to 85, 87, 90 years old and your blood pressure is a little high, some people find that that is actually beneficial. So taking a person's age into consideration when it comes to blood pressure is very, very important. The seventh flaw is not following the standardization of technique when it comes to checking blood pressure. So let me go over that with you right now. I mentioned the first one was to have a resting blood pressure measurement, not an excited, angry, upset blood pressure technique. So how it works is this. When you first go to the doctor, what the doctor should do is have you just relax in the room, maybe take a couple deep breaths, just to kind of relax. Then, when they check the blood pressure, it should be in a chair with your feet flat on the ground. You should have a back support sitting upright, and your arm should be supported to about heart level. When they use the blood pressure cuff, what they should do is tighten it such that they can get 2 fingers into the cuff between your skin and the cuff. If they're wrapping it around super tight, then you're going to have a mismatchment. That didn't work. If they put it too tight, it's going to read too high. Let's just keep it at that. Also, when they check the blood pressure, they shouldn't push it up too high. This is one of the problems with automatic blood pressure machines. Automatic blood pressure machines very often go too high, cause pain to the patient. Well, now the pain is going to cause them to have higher blood pressure at that moment. But that's the way blood pressure should be checked. In addition to that, you should always go to the bathroom to make sure that you are, you don't have a full bladder, because that can affect blood pressure. You should not have coffee or cigarettes right before the blood pressure measurement. And this is a standardization. This is the way every healthcare professional is taught to check blood pressure. But sometimes you go into the doctor's office and one time they're checking the blood pressure on the wrist, the next time it's on the arm, the next time it's on the other arm, and they have you with your feet dangling on the exam table. You have no back support. Then they check the blood pressure with your arm hanging down low. And then they're talking to you, trying to do their depression screening or asking you questions about your pain as the automatic blood pressure machine is doing it too tight. That's a recipe for disaster. So there has to be a standardization of treatment or standardization of examination so that you can compare apples to apples rather than apples to oranges. I mean, imagine if the eye doctor checked you for your eyesight with different machines at different times under different circumstances with different letters. You don't have a standardization of examination, and that's why the numbers can be all over the place. The 8th and final flaw is ignoring pain, or worse, the doctor producing pain during the exam. When patients have pain, which is, at least in my office, I've been in practice for 29 years as a doctor of chiropractic, so I use natural healthcare methods to help people. But when someone comes in that has a herniated disc or a back spasm, that is not the time to check their blood pressure. Pain increases the blood pressure. Pain does a lot of things, but essentially pain will secrete cortisol out of the adrenal gland. You've got a nervous system response where it's a fight or flight situation in the nervous system. So their blood pressure is going to skyrocket, particularly the first number, if a person's in pain. And so checking blood pressure when a person's in massive pain is kind of worthless because you're not getting an accurate reading of their resting blood pressure. Likewise, if the doctor is putting on the blood pressure cuff too tight using an automatic blood pressure machine, which is just the standard these days, and pumping it up too hard, very often the patient will get a cortisol as well as a sympathetic nervous system response to the pain that the doctor is inducing by pumping it up too high. So if that's the case, you can simply ask the doctor to check blood pressure using a manual cuff, and if they're skilled, they'll know how to check the blood pressure without doing too much pain with the blood pressure machine. So I hope this has been helpful for you. I'm sure there's some that I've missed only because I just try to limit it to a certain number per video. But if I have anything that you have a concern with, put the comment down below in the comment section. And then, this is the important thing, there are some big mistakes that people make when checking their own blood pressure, and some doctors' offices make these mistakes too, simply because they're busy. So watch this video right here. This is the other mistakes that can be made when checking blood pressure.